How is it that you as a dentist got interested in dealing with sleep apnea?
Realized that a lot of my dental patients had headaches. Understood about this whole thing about TMJ. So I take this program at UMDMJ, and we're treating patients up in Newark, this 2-year program. And the patients that aren't responding to treatment all wind up having sleep issues. Before the 1980s, tracheostomy was the only cure for sleep apnea.
A hole?
A hole in your trachea.
Whoa.
Most people didn't care for that. All of a sudden, down under, this crazy Australian takes this vacuum cleaner, puts it in reverse. We're hoping that he cleaned out the filter in the airbag, hooks it up to a hose, sticks it in his face, the world's first CPAP machine to open it up. Second treatment is where you do surgery on the soft palate, done by ear, nose, and throat. Works well on a small percentage of people, but if you're choking in the oral pharynx or the hypopharynx, which is below the tongue and above the voice box, trimming that stuff doesn't work. 20 years ago, the oral appliances came. The way they really work, most of them, is that you're moving your jaw forward. If your jaw goes forward, your tongue comes along with it. Also, it tightens up your throat muscles. If you remember in CPR, they put your head back, move your jaw forward. So this is the ABCs of CPR. This is nothing new, but it sort of got rethought.
So, doctor, I want to actually hold the devices. They don't look like they're that complicated, like they'd be easy to use.
That's a tap appliance, been around for 4 or 5 years.
Okay.
Very successful in that period of time.
And how is it different than these two devices?
Well, this one encroaches the tongue a little bit. Mm-hmm. The big progress in the last 5 to 10 years is that you can titrate the jaw position within 1/4 of a millimeter, this device 1/10 of a millimeter, so you can gently move your jaw forward and change the vertical opening. This one is another Australian import, just like the CPAP was originally, the Somnamid. And this allows you, if you want to drink or speak, really, really comfortable. And then there's a side mechanism here to allow you to move it 1/10 of a millimeter. Either, I would do this, or I can instruct the patient to do it. If they're coming a distance, we train them to do that. And we'll do a telephone consultation to help them titrate to get them into the right spot. And this is a modified Hertz, similar. And the real trick is to find the right appliance. We have the experience to know which appliance would work best in your particular mouth. That's the expertise and the intellectual property we have.
Do you yourself actually use the device that you would advocate others wear to deal with their sleep apnea?
Been doing this 20 years, and just by chance, 8 years ago, by trying out some new designs, I felt a big difference. Even though I only had 4 hours of sleep that night, felt like I had 12. So then it was time to go for a sleep study, get it officially diagnosed, and I already had the devices, so it was a no-brainer for me.